If you're dealing with arthritis issues, in this video I'm going to share a study that I found and help you understand why there seems to be some strong correlations between gut dysbiosis and arthritis issues. You don't want to miss this.
TC Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So just remember, I'm not a doctor and I'm not giving you any medical advice or any advice on how to fix your medical arthritis type condition. I just want to share this study that I found, and I'm going to put a link in the description below along with some other papers that might give us some indications of what may be creating this correlation between the gut dysbiosis and the joint arthritis type problems. So when we're looking at arthritis, there's actually a variety of underlying causes that can create arthritis. We're probably not going to talk about all of them in this video, but we hear a lot about this structure of all this cartilage and the connective tissue and all this stuff that helps that joint move real nice. And oh, that's nice. When this stuff starts to deteriorating, it's like, oh, that's not so nice. And it can create a lot of problems. It can even break down to the point to where you get that part of it is bone on bone, just kind of hitting each other and really creating a lot of inflammation and pain. So we really don't want to have that. That's not a good time for anybody. But we hear a lot about that cartilage breakdown. We also hear about like, oh, there's a bone spur in there, and like calcium deposits that can kind of get in there and also create pain for totally different reasons. So we hear about that kind of stuff, and there just seems to be a lot of confusion for people that say, oh, I don't understand what's happening. Because you hear about people saying, oh, there's calcification problems, but then they say, well, no, the calcification problems isn't deposits, it's these things deteriorating and becoming thin and not really supporting the joint the way that it should and creating those bone-on-bone type issues. So it seems like different people use different terminology to where you just take a chump like me or you and we don't really understand what they're talking about. It just seems to create a lot of confusion. And of course we know that inflammation can also be a problem, and there's a wide variety of things that can create inflammation in a joint and create similar symptoms to what we're talking about. And you might not actually be a chump, and kind of thinking about it, I'm not sure if people even say chump anymore. I might have just aged myself a little bit there. But basically what we want to do is we want to look at this in a way that makes sense to a human. How about we say it that way? That's what we kind of want to look at. So let's look at why this gut correlation is showing up when we're looking at arthritis. And when we're looking at arthritis and we want to understand this gut dysbiosis, which is basically just a bacterial imbalance in this area, in this large intestine. And there's problems that can show up in the small intestine like a SIBO, like a small intestinal bacterial overgrowth. But just this dysbiosis that they're talking about is that there's a problem where maybe there's too many bad guys in there and not enough good bacteria doing the things that we want that good bacteria to do, and maybe the bad guys are creating a lot of trouble. So when we look at how this comes about, it's important to understand how the digestive function really was supposed to work. And so we want to look at stomach acid, and when we eat food, our stomachs should make hydrochloric acid or HCl, and that stomach acid is made to help us start to acidify that food so that it can break down properly. That makes sense. We've all heard of that. We need the food to break down. So once this food is acidified and it leaves the stomach and goes down into the duodenum, then the gallbladder should squirt this alkaline bile down there to help us neutralize our acids. It helps us emulsify our dietary fats and access fat-soluble vitamins. So all those things are very important. So there are really two big steps to the digestive process that have to happen, and that bile flow is important, and we'll kind of talk about why in a second. But it's really common for people either not to be making enough stomach acid, and it's really common for someone's bile to become too thick and sticky to flow correctly, and then it won't come down there, and it won't help us emulsify our dietary fats, and it won't help us really neutralize those acids and create like this sizzle that helps us really bust the food apart and get all the nutrients out of that food. So if this is a problem and someone is not making enough stomach acid, well, the stomach acid doesn't just help us digest our food, it's like the barrier to the whole digestive tract. Any varmints that come in on the food that we're eating get fried in an acid bath by that stomach acid. So it's killing off these bad guys that come in. So if someone is not making enough stomach acid, then the bad guys come in, and then they work their way down here, and they set up camp in here, and then they work through, and they create all this dysbiosis by kind of taking over the whole town. So this becomes really important when we're looking at arthritis, because this cartilage stuff here, that's stuff that the body makes. The body makes that. It doesn't just show up on back order or something. We make that stuff. And the body needs collagen to make that. And in order to make collagen, the body uses amino acids. And amino acids are basically the building blocks of just about everything in the body that the body's going to build. And amino acids come from properly breaking down protein. So this stomach acid is what we use to break that protein down. So if a person is not making enough stomach acid, or maybe they even have an overgrowth in the stomach that's making that stomach too alkaline because the waste from that bacteria is alkaline and restricting the acid's ability to really acidify that food. That can be another problem that can restrict the body's ability to break our proteins that we consume down into these amino acid structures. I'll also put a link to a paper below that talks about how important vitamin K is for that cartilage structure. And vitamin K is a fat-soluble vitamin that we can't really access if bile is not coming down there and helping us digest our fats and access those fat-soluble vitamins like A, E, D, and K. So that could be a really big problematic situation and part of this digestive malfunction that can lead to these arthritis type problems. We also hear about some minerals that are important in this collagen structure that the body uses. So we can see that we really want this digestive function working correctly so that we can access these things that the body needs to rebuild those connective tissues. So if you're dealing with any type of digestive symptoms at all, like burping or bloating or acid reflux or constipation or diarrhea or nausea, or maybe food just kind of sits there like a rock in your stomach for 6 hours, or even skin issues can be a sign of digestive malfunction. So any of those symptoms are a sign that either one or both of those sides of digestion might not be working correctly. And to take this a step further, let's come back here and let's look at these amino acid functions in the body. Because maybe you only have a little bit of digestive malfunction going on. Maybe digestion is working okay, but it's just not working great. Well, you may be accessing some amino acids from your food, but you're not really breaking down the food to the point where you can really get everything out of it that you're supposed to. So there's a lot of other functions in the body that require amino acids. Like they're used to maintain this healthy skin, hair, and nails. It's used to build muscle, grow and repair body tissues, and that can mean just about any tissue in the body, even organs. Make hormones and brain chemicals, boost your immune system, helps you break down food and sustain a digestive system that's supposed to work. So this is a lot of stuff in the body that requires amino acids. So if what you're accessing from the food that you're eating is low, then you might not have enough to go around. Maybe this little structure right here in your knee is not the priority to your body that, say, your lungs are, and repairing those types of organs and other tissues that the body might view as a little bit more critical for your survival. And I'm also going to put a link in the description below for an article about connective tissue deficiency syndrome. And they kind of say with this problem that a person will basically break down connective tissue faster than it's being rebuilt. And I'm going to point you to a video in a minute where I talk about this type of situation in a little more detail and other possible causes of that type of problem. But we also need to look at supply and demand. If those connective tissues and all these structures can't be rebuilt faster than they're being broken down, then could it be a supply and demand issue? Does the body just not have the resources that it needs to rebuild in order to keep that structure functioning the way that it's supposed to function? That would make a lot of sense if that were the case. So again, I'm not saying that this is the cause of your arthritis or this is the cause of all arthritis. It certainly is not. But if a person is having a lot of digestive symptoms already and they're dealing with arthritis, wouldn't it make sense to correct those digestive symptoms to see, does that create any improvement by giving the body more resources that the body needs to rebuild tissues the way that they're supposed to be rebuilt? So if you want to learn more about correcting digestive malfunctions, my book, Kick Your Fat in the Nuts, chapters 3 and 4 kind of walk you through which aspects of digestion might not be working correctly for you and steps you can take to correct those. And the book is available on Amazon, but I'll put a link in the description below where you can get the whole thing totally for free. So when we look back now at these causes that are most common with arthritis, and we're seeing this cartilage breakdown, it starts to make sense that, yeah, if the body didn't have the resources to rebuild those tissues, wouldn't they eventually just deteriorate? And another problem that we have to look at is that when the body isn't getting the resources that it needs to function the way that it needs to function, all of these functions down here that we talked about where amino acids are required, some of them are very important for us to survive. So when the body doesn't have what it needs to function correctly, it will steal some of those nutrients from us. We can become the 7-Eleven that the body shops at, and it might break down muscle or even connective tissue and other things to access these amino acids to help other things function. So is it possible for the body to break down these type of connective tissue structures to access other nutrients? A lot of people believe that that's an absolute possibility, and that seems to be going on with some people. And we're looking at inflammation. A lot of these things that we talked about with the digestive malfunctions could create some inflammation in the body. And when we're looking at calcium deposits, a lot of times when someone can't break down protein correctly, they'll feel really lousy if they eat like a steak or some type of protein, because it'll sit there in their stomach for like 6 hours and just rot and ferment, and they just feel horrible. So they'll start gravitating more towards eating more carbohydrates and sugars and things that are a lot easier to break down. And a problem with that is that when we consume a lot of carbohydrates that are turned into sugars, we know that calcium likes to follow sugar. So calcium can leave the tissues and follow that sugar. And then when the sugars get burned up, the body will just deposit that calcium wherever. Because if too much calcium is in the bloodstream, it can cause a lot of problems. So the body can try to pee it out, or it'll just kind of deposit in these other places that can end up in joints and create some of these calcium deposit type issues. So is that something that the study was seeing as far as relation between this gut dysbiosis and the arthritis type problems? I don't know, but it makes a lot of sense that those things could be connected if these digestive malfunctions were changing the way that a person would eat. So if the body needs resources to rebuild these structures and we get those resources from the digestive process, it does kind of make sense that if somebody had some type of gut dysbiosis or digestive malfunctions, that it could create some problems there, or at least contribute to those problems. But if you want to understand some other reasons that these structures might be breaking down faster than they're rebuilding, then jump over right now and check out our video on Is Glucosamine and MSM for Arthritis a Mistake? And I'll help you understand some other issues that may be creating trouble there. I can't wait to hear about your results.